Welcome to Adapt NCLEX. Oncology and chemotherapy drugs are very difficult because we don't use them. And therefore, when they show up on the NCLEX or nursing school exams, you can struggle with it. I have 15 questions. I'm going to make them easy. Practice question, pharmacology test 14. This is the video you want to watch a day or two before you take your NCLEX. So let's get to it as we conquer these chemotherapy and oncology drugs for nursing school. The first question is just to get you set up. It's a pharmacology, but at the same time, you have to know from fundamentals of chemotherapy drug. And nurse is teaching a new graduate about chemotherapy safety precautions, which statements are correct. Select or apply. The buzzword is chemotherapy safety precaution. And we want to select or apply. Pick those that you are 100% confident, but read the answer choice and see if it makes sense, right? It's a chemotherapy drug. Most of them are vesicant. Most of them are poison. And therefore, based on that knowledge, what do you think? Wear PPE when preparing chemotherapy drug. Dispose of chemotherapy waste in a puncture-proof label container. There's a reason why those words are there. Wash hands before and after handling chemotherapy agents. Wear gloves when giving vesicant chemotherapy drugs. Use a dedicated biohazard container for chemotherapy contaminated linen or body fluid. These are our buzzwords. Disposal of chemotherapy drugs and tubing in the regular trash. You see, I use the word regular trash. The key word is what? Of course, you touching a poison, a chemical, or your PPE, right? Disposal of your chemotherapy waste in a puncture-proof label container. That's the right thing you're supposed to do. Wash hands before and after handling chemotherapy agent. That's right. Wear gloves when giving vesicant chemotherapy drug. That's right. Use a dedicated what? Biohazard container for chemotherapy contaminated linen or body fluid. That's good. Disposal of chemotherapy drugs and tubing in the regular trash. That's not good. Therefore, how do you remember these medications? And what fundamentals of pharmacology regarding chemotherapy agent? What do you need to know? The mnemonics is what? Chemo. And I will show you. The first one that we talk about is what? Wearing your PPE. That's good. Then you dispose them in a puncture-proof label container. Then you wash your hands before and after handling chemotherapy agent. Of course, you got to use a dedicated biohazard container for chemotherapy contaminated linen and body fluid. And then you got to wear gloves. You should not dispose chemotherapy drug and tubing in a regular trash. So what does that mean? Chemo. Chemo means this. This is the mnemonic fundamentals of chemotherapy pharmacology drugs. And this is what you're supposed to know when they ask you questions on fundamentals. C is what? Contain waste properly. That means biohazard containers, not regular trash. You don't put them in regular trash. You got to wash your hands before and after, right? The E, wear your equipment. Those are your PPE. Protect your face, high shield, splashes, any area there's going to be splashes, you got to protect yourself. And M, make sure you mark or label waste as what? Chemical hazard. And use what? Punctured proof container. Very, very important. And the O, I did not put it as one of the answers, but only trained staff should be able to prepare and administer chemotherapy. Never forget these chemo mnemonics. This is going to help you in fundamentals regarding chemotherapy agents. Number 2, a client receiving chemotherapy developed tumor lysis syndrome. Which lab results is a priority? This, you got to bring your content. What is tumor lysis? This is the tumor cells. Inside the cell, you know, we have a bunch of potassium, right? That's the first scheme. And then we have a nucleic acid over there, like that. This is the problem. And therefore, outside the cell, we have a bunch of calcium, right? When you expose a cell to chemotherapy, everything will burst. And you have a bunch of phosphorus inside. When the tumor bursts, potassium level increases. You go outside into the blood. What happens? Your nucleic acid goes up. Your phosphorus goes up. And you go and chew all your calcium, and your calcium goes down. So these are some of the most common lab work you see. High potassium, what? High nucleic acid, which turn into uric acid, high phosphorus, and low calcium. This is classic, what? Classic tumor lysis syndrome. Some people will call it K-UP-C, right? K-U-P-C. So potassium, uric acid, phosphorus, what? All of them goes up, right? And then your what? Your calcium go down. What is going to happen? In this lab work, they say, which lab is a priority? Well, you know, potassium is not supposed to go down, it's supposed to go up. So this is wrong. Don't pick it because you see hypokalemia is bad. It does not meet the definition of tumor lysis syndrome. Hyperuricemia, I expect that. Hypocalcemia, I expect that. Normally, your sodium remain normal. But the question says priority. You have uric acid and hypocalcemia. Which one is dangerous? Uric acid will affect your kidney, but which one is going to kill you? Seizures and cardiac arrhythmia is very important regarding what? Calcium. Therefore, I'm picking number 3. This is some of the test taking strategy you should be familiar with. Low calcium can cause stenting and seizures. It can lead to laryngeal spasm, airway obstruction. Therefore, that's our priority. 3 is our right answer. These are little things you have to pay attention to. Which nursing assessment is a priority? The same thing. A nurse is receiving Doxorubicin. For all these questions, I'm not going to give you anything that you don't need. Just 1, 2 things you have to know about this medication. And then when you see it, that's what they're going to ask you. If they don't ask you, email at that NCLEX. Doxorubicin. What is the number 1 thing you have to know? If you watch this video and you don't remember anything about this, this is cardiotoxic. Because it's cardiotoxic, what do you think? Is it going to affect your heart rate? Do you check for lung sounds? Do you check for cardiac ejection fraction or blood glucose? Don't pick number 2 because it's a lung problem. Not everything is airway. It does not answer the question. If the answer choice does not answer the question, even though it look bad, don't pick it. Don't pick lung sound. Because the effect is a cardiotoxic, you have to know that your heart is going to be toxic. If your heart is toxic, it's not going to speed up. It's going to slow down. Therefore, cardiac ejection fraction is the best answer. So monitor ejection fraction before therapy. This is very important. The client receiving cyclophosphamide complain of what? Hematuria. What should the nurse anticipate? This medication, there's one thing, if you don't know about it, is that symptoms the patient is complaining about. Blood in the urine. What should the nurse do? Hold the nurse dose, encourage fluid, give them furosemide, and teach low protein diet. One of the complications associated with cyclophosphamide is hemorrhagic cystitis. There's going to be blood in your bladder. What do you need to do? Wash it out. How do you wash it out? Not to give them laces. If you give them furosemide, they need fluid for the furosemide to work. If you don't have fluid in your system, furosemide is not going to work. Holding the next dose, you have not done anything. Patient have symptoms. At this point, you know the problem. Encourage fluid intake. That's the best way. So hemorrhagic cystitis, what do you need to do? Hydrate and notify the provider. So cyclo, see blood, hydrate yourself. That's the mnemonic. What is the priority next action? For a client with neutropenia from chemotherapy, neutropenia means your WBC is low. It's a sign of infection. Therefore, based on that buzzword, I need to prevent infection. Applying warm compression to IV site does not answer the question regarding neutropenia. Encouraging visitors is a bad idea because they will make the patient sick. We don't prevent them, but we want them to wear PPE when they come in to see the patient. Iron does not answer the question. Therefore, what is left? Number 4, place the client in a private room. I use some of these answer choice to tell you when the answer is obvious, don't pick something else that is distractive. Neutropenia is infection. Pick an answer choice that is infection. That's all. A nurse is caring for a client receiving what? Methotrexate. This medication, you have to know it because it's very common. Used as chemotherapy agent, it can also be used in rheumatology. Which adverse effects should the nurse anticipate? Methotrexate is a cancer drug. Therefore, you know that cancer drug, if you don't pick anything at all, something related to immunosuppression. I don't see immunosuppression, but all I see is what? Alopecia, peripheral neuropathy, hyperglycemia, and weight gain. There's no chemotherapy agent that make you gain weight. Only chemotherapy agent that make your glucose go up is steroid. Therefore, that one is out. We use steroid for other agents like lymphoma. Now you're left with 1 and 2. Peripheral neuropathy is specific for one chemotherapy agent, and we're going to see it. Alopecia is one thing you have to know about methotrexate because of the immunosuppression. And therefore, things you need to know, hair loss, MAF, SAW, right? And bone marrow suppression. There's additional one you have to know when you see it. Your liver function can get affected. It's also teratogenic, right? And therefore, pay attention with these side effects regarding methotrexate. It affects your liver, it's teratogenic, and bone marrow suppression, in addition to what? Hair loss and SAW MAF. Therefore, the right answer is alopecia. And this is caring for a client experiencing methotrexate toxicity. Question 7. What have you done so far? You've been watching this series. I know you got this pharmacology down. I hope you get 6 out of 6. Answer the question, just type, I'm ready. I'm ready to conquer NCLEX. Number 7. A nurse is caring for a client experiencing methotrexate toxicity. Which drug is given to prevent methotrexate toxicity should the nurse expect? This is a content level question. You know methotrexate side effect. There is a way we can prevent the side effect of methotrexate. There is a medication we give with methotrexate to decrease its activity. Do you think it's allopurinol? Do you think it's Ondansetron? Do you think it's Filgrastim? Do you think it's Leucovorin? Allopurinol is used for gout, right? You can also use it for Tumor Lysis Syndrome. Ondansetron is used for what? There's a question you will see. Nausea induced by chemotherapy. Filgrastim is used for what? Increase your WBC. We'll see a question like that. Leucovorin is the drug that you can give together with methotrexate to decrease methotrexate toxicity. Don't forget Leucovorin. Therefore, Leucovorin rescue normal cells from methotrexate toxicity. That's the key answer. So Leucovorin is a lifesaver for methotrexate, and that is the mnemonic you should be aware of. The client receiving chemotherapy drug for breast cancer complain of what? Nausea, which drug is commonly given with chemotherapy to prevent nausea and vomiting. I already given you the answer. Ondansetron, metoclopramide, lorazepam, diphenhydramine. Diphenhydramine is Benadryl. It's used for, and is an antihistamine, right? Allergy medication. Lorazepam is used for what? Anxiety. Metoclopramide and Ondansetron are good for what? Nausea. But the one that is best for chemo-induced nausea and vomiting is what? Ondansetron, because of the serotonin antagonist effect of it. So that's the medication. And then it teaches a client taking what? Tamoxifen for breast cancer, which statement indicate understanding. Tamoxifen is the drug used for breast cancer. Which one indicate correct understanding? I will stop taking it if I feel hot flashes. I will report calf pain or swelling immediately. I can take a pregnancy test later if I miss a dose. I can double my dose if I forget one. Test taking strategy content. You know breast cancer has estrogen and progesterone receptors. Therefore, if I'm giving you medication to treat breast cancer, that means it's going to block estrogen and progesterone receptors. In the process, a major complication associated with these medications is what? Clot. Therefore, clots are bad. You can get DVT, you can get PE, you can get stroke. Hot flashes is a common side effect of those medications because they block estrogen, right? They are teratogenic, so you can't talk about being pregnant. We don't want you to get pregnant. So 3 is a trap. I don't want you to get pregnant, so use something to prevent you from getting pregnant. Checking for pregnancy tests, no, we don't want you to do that. We don't want you to get pregnant anyway. You should not double the dose. So tamoxifen increases the risk of DVT and PE, and the key fact is this. If you want to remember, side effect of tamoxifen, the T, we call it TAMOX. T is thromboembolism. A, you should avoid it in pregnancy. M, you're going to have menopause-like symptoms. That's the hot flashes. You're going to have vision changes. And S, you should do extra monitoring so that you don't get pregnant. Now, a client is receiving chemotherapy, prescribed what? Filgrastim. Why? What is the purpose? I know you get this, 10 out of 10. Put down your answer. Let me know and tell me that you get this answer choice. What do you think? What is filgrastim used for? To increase your red blood cell, to increase your VBC, to increase your platelets, or to reduce alopecia? Number one, you know that is wrong because ipotine is responsible for increasing your RBC. The VBC is usually stimulated by filgrastim. Platelets, wrong. And we'll see an answer choice later on, a question related to that, why platelet is wrong. The medication, I will give it to you, is opraverkin. Opraverkin is the one that increases your platelet. Number 4 is wrong. Therefore, right answer is number 2. The client receiving cisplatin should have which lab monitored closely? Cisplatin is nephrotoxic. If it's nephrotoxic, what drug or lab work do you look for? Creatinine and BUN. Like I said, straightforward to the point. The client receiving allopurinol. Allopurinol during chemotherapy should be taught to do what? Allopurinol, think about it, we use it in gout, right? To prevent uric acid formation. Therefore, we want to prevent uric acid breakdown. In chemotherapy, when we give it to you, we have increase in what? Uric acid. The reason why we want you to take allopurinol is to prevent what? What do you think? At the same time, what kind of teaching would I provide you? Allopurinol is going to protect your kidney. If I'm going to protect your kidney, what would I do? Test taking strategy. Look at number 1. He said, avoid water intake. Number 2, he said, take with plenty of fluid. I'm not even looking at 3 and 4 anymore. I see 2 answers that are opposite each other. One of them is the right answer. Therefore, allopurinol prevents uric acid kidney damage from tumor lysis. What would you do? Increase your fluid intake. A nurse is caring for a client receiving chemotherapy drug via IV, which client teaching is best to prevent extravasation. Most chemotherapy agents are vesicant. They can cause necrosis of the skin. What is the best way to prevent extravasation? Do you check it more frequent? Do you apply ice if you become red or swollen? Or remove what? Or rub the IV site if you turn, if you burn, or rub the IV site if you burn during chemotherapy, or remove the IV if you hurt a little bit. Think about it. Do you want to remove IV if you hurt a little bit? And do you want to teach the patient to do that? Which client teaching is best to prevent? You tell the patient, hey, put it up if you start hurting a little bit, or you tell the patient to rub it, or patient to apply ice, or check the IV site frequently during chemotherapy. Frequent checking is the best answer, so that before they start hurting, it's too late. So I want to check, make sure no changes before I can do that. So frequent monitoring is your best boy. What is the next best action? The best, okay, is the number one. A client receiving Filgrastim report what? Numbness and tingling in their fingers. Do you decrease the medication dose? Do you let the doctor know? Do you give the analgesic or apply warm compression? I've given you the side effect of what? Filgrastim. That is the peripheral neuropathy medication that we saw. Filgrastim is used for what? It's a chemotherapy agent, and the major side effect is numbness and tingliness. Question 14. If you see that, what would you do in that situation? Do you decrease the infusion rate? Let the doctor know, provide analgesic, or warm compression? What do you think? Of course, we're going to decrease the dose. That is the ultimate thing that is going to happen. But not right now. You are not the responsible. It's dose dependent. The presence of peripheral neuropathy is dose dependent. We got to decrease the dose. But that is not your job. I will talk to the doctor, and then he will decide what he want to do. Notify the provider. And the last one, a client receiving Filgrastim report what? Epistaxis, right? Lab value shows 80,000 of platelet. Which prescription should the net anticipate? Ibuprofen, Filgrastim, Opravenkin, adalimumab, dipyridamole. Think about it. You should recognize all those medications. Platelet is low, having nosebleed. You know Ibuprofen is used for red cell, it's gone. Filgrastim is used for what? WBC is gone. Opravenkin will increase your platelet, good. Adalimumab is immunosuppression. It does not affect your platelet. And the last one, dipyridamole, is what? Antiplatelet. It's going to worsen your platelet. Therefore, we only have one answer choice. 15 question, NCLEX practice question, chemotherapy drugs. I hope you know them, you master them. NCLEX practice question following the pharmacology series, and you find something that will help you. Watch this video a day or two before you go and take the NCLEX. When they show up, you pop up like a candy. Thank you for following the series. Bye.